Good afternoon. I hope that you all had a healthy celebration of the new year. I'm optimistic that 2022 will be a year of recovery and success for everyone. So far, we have administered more than 19 million vaccines in Illinois, over 2 million of which have taken place at our state-run vaccination sites and thousands of mobile clinics. We have fully vaccinated nearly 90% of Illinois' we have fully vaccinated nearly 90% of Illinois seniors, and 75% of eligible seniors have received their booster. We are the leader among the most populous states in the nation in 5 to 11-year-old vaccinations since the moment the FDA authorized them. And we have been leading all of our neighboring states in keeping people alive and out of the hospital despite the Omicron variant rapidly spreading. About our progress against Omicron. Unfortunately, we are reaching all-time record numbers of cases and surging hospitalizations, so we must approach this first several weeks of January with a good deal of caution. At a time when some have chosen to politicize vaccinations as a way to polarize our politics, Illinois state government is focusing on science, as we have throughout the pandemic, which is why we're redoubling our efforts to get more people vaccinated and boosted every day. The unvaccinated are the ones filling up 85% of our COVID hospital beds and 95% of our ICU beds, and nearly 100% of our ventilators. So getting vaccinated and boosted remains the strain on our healthcare workers and hospitals. In Illinois, as is true in many cases across the United States, our COVID-19 hospitalizations are now even higher than they were last winter when vaccines weren't yet widely available. Is still only a week or two in the rearview mirror. I fear the climb will continue as the virus incubates in those who were exposed at the end of December. In the pediatric wards, the number of Illinois children entering the hospital with COVID-19 has nearly tripled since the beginning of December. But staffed ICU beds for other emergencies like car crashes and heart attacks and strokes are frighteningly limited, in just the single digits. Last week, I joined the Illinois Health and Hospital Association in urging providers to postpone non-emergency surgeries so they can use existing staff to expand ICU capacity wherever possible. We have also adopted the CDC's updated guidance for healthcare professionals to shorten the amount of time that they need to be out if they are exposed to COVID or catch COVID themselves. Today, I'm grateful to be joined by A.J. Wilhelmi, the President and CEO of the Health and Hospital Association and leading healthcare professionals who will share how their hospitals are handling this latest surge. It is frustrating and tragic that 2 years into the pandemic, with multiple widely available and free life-saving vaccines, that we are once again in this horrible position. Neighbors are holding off on important medical care like hernia repair, colonoscopies, and early-stage cancer treatments. We are on the eve of the second year of this pandemic. We have entered the third year now of this pandemic, and our hospitals and healthcare workers continue to care for their patients under extraordinarily challenging circumstances. They are under tremendous strain, and I don't know how much more they can withstand. We must all find ways to support them in every way possible. I'm here today to reiterate that we do have the tools to get through this. It's time for everyone to join in using those tools. First, stay home if you are sick. And if someone you know is sick, take extra precautions. Second, get your vaccination and get your booster. Third, wear your mask. An N95, KN95, or a surgical mask are best and reduce transmissibility by 53 to 90%. A cloth mask is less effective, but it's much better than no mask at all, and it provides some protection for the people around you. Lastly, if you have a relative, a coworker, or a neighbor who is hesitant about getting vaccinated, take them, sit them down, talk to them about your own experience. Soothe their fears. Reach out with kindness and with compassion, but above all, reach out. That conversation maybe begins by saying something like, "I care about you, and I really want you to be healthy and safe." Over the holidays, I announced the state of Illinois is more than doubling personnel and adding at least 100 people to local health department vaccination sites, reaching tens of thousands more Illinoisans every day. We also continue to bring boosters and vaccines into communities that request them. If your organization would like to host a vaccination clinic, please visit IDPH's website, where you'll find a link to sign up so that we can bring a vaccination clinic for everyone in your organization to you, everyone who isn't yet vaccinated or needs a booster. Testing is also vitally important for keeping you and your family and your coworkers safe. Starting today, our free community-based testing sites have expanded to 6 days a week to increase COVID-19 testing availability across the state of Illinois. That's a 50% increase. These free tests and test sites are located in Aurora, in Arlington Heights, South Holland, Fairview Heights, Peoria, Bloomington, Champaign, Harwood Heights, Rockford, and Waukegan, as well as at all local health departments. You can find more information about where you can get tested at coronavirus.illinois.gov. This morning, the FDA also made two very welcome announcements related to booster shots. First, 12 to 15-year-olds will be eligible to get their booster shots shortly. The CDC is expected to support the expansion later this week, and as soon as they do, Illinois will be ready to get eligible teenagers this extra protection. Second, the FDA moved to reduce the waiting period for Pfizer and Moderna boosters to 5 months from 6 months. The CDC is also expected to sign off on this reduction very soon, meaning that anyone who got their full Pfizer or Moderna vaccination before early August will be eligible for a booster shot. Millions of people here and around the world have safely gotten boosters, making them more protected more quickly, and this is good news. State government remains vigilant with widespread testing and vaccinations and maintaining healthcare capacity, and all Illinoisans need to focus on keeping each other safe. Where we go next as a state is a matter of all of us pitching in. Each of us can get vaccinated, get boosted, and wear our mask when in spaces with other people. And I ask everyone to do their part.